Hello everyone, this is Dr. Rawls. The question, why don't doctors understand Lyme disease? This is an easy one for me because I've been on both sides of the fence. I have been a physician for 30 years, and 10 years of that, 10 years ago, I was struggling with Lyme disease myself. So I really have come to appreciate the fundamental flaws in our medical system as far as looking at these kinds of illnesses. So when you look at Lyme disease, there's acute Lyme disease that people get bitten by a tick and they become acutely ill. But actually that's not very common. Most people don't become significantly symptomatic after a tick bite. It's later when their immune system becomes depressed, and then they start having all of these chronic symptoms with a full range of symptoms, from everything from brain fog to joint pain to all of these dysfunctional symptoms throughout their body. And that is very frustrating for physicians because our system is designed to address acute illness. We do a really wonderful job when somebody comes in with a broken leg or a heart attack or a pneumonia, because that is an acute fix problem. But I can tell you, when somebody walks in with a list of 20 to 30 complaints that are all over their body and none of the lab tests are really significant, and that doctor has 15 minutes to solve that problem and have that patient on their way, diagnosed, bundled up with the right coding and the right therapy, it's just not going to happen. So physicians find that situation extremely frustrating. When they have to deal with conditions like fibromyalgia and chronic fatigue and chronic Lyme disease, they get very, very frustrated because they're caught between not having enough time to really think about it and not really having good therapies to solve the problems. Because when you look at chronic Lyme, conventional antibiotics don't work very well. There's good proof that long-term conventional antibiotics have very little value in chronic Lyme. So it comes down to that test of whether they have a positive Lyme test or not. That is often equivocal, and they don't know how to interpret it. So it's really very, very frustrating for physicians to understand and deal with this problem. So it has come around to the fact that most people are having to figure it out for themselves. And that's one of the things that we have done at rawlsmd.com. We provide a lot of information that helps people understand this very, very frustrating illness and the steps that you need to take accountability for your own health and learn about the steps that you need to go through to recover from this illness. These are things that I had to do. I struggled with it for many years, and I found very, very little help from the conventional medical community. So what we try to do is give people information so that they have what they need to move forward in their recovery, and help them use the medical system better so they know what to ask for their doctor. Not to go in with that list of 20 to 30 complaints, but to go in with very specific questions to know how they're going to get the best care so they can address one problem at a time in a way that's not going to overwhelm their physician, so that they can use that system to their advantage instead of their disadvantage. So again, if you want to know more, please check out my website, rawlsmd.com. We have a newsletter that goes out regularly that answers a lot of these kinds of questions. The programs that we put together are really fundamental information for how you can move forward in your recovery. Thanks for watching my video. I hope you found it helpful. Be sure and subscribe to my channel so you don't miss any upcoming videos. And while you're at it, please take the time to leave me a comment. I would really like to know of any questions that you might want answered in future videos. Thanks for watching.